I do to get rid of my knee pain? I get it. You want your pain gone, but you're not too sure what to do or where to even go to find it. There are so many options, and what I'll go through today may not even be a complete list. I'm sure I missed some things. But before we do that, go ahead and hit the subscribe button. Running with arthritis without the knee pain is possible, and it only takes a few simple steps. So go ahead and subscribe so you can know exactly what to do to run without knee pain. And not all options work for everyone. One thing may work for another person, but not you. It's important to know there are many options out there to try and to know which options are the best for what type of problem. Should you get cortisone injections? Cortisone injections are a steroid injected directly into the painful area for anti-inflammatory benefits. I found the people who get the most relief from cortisone injections are the ones who have so much pain they can't sleep. They have pain most, if not all of the day, and their knee keeps them up most of the night. They can't stay asleep any longer than 2 hours because the pain wakes them up. People who don't end up saying they get good relief from cortisone injections are people who have occasional pain that comes and goes. Am I saying that those people shouldn't get cortisone injections? No, I'm not saying that. I'm saying that the people in this category who get cortisone injections end up saying that the pain didn't really go away compared to the people who had pain all of the time. Some considerations for cortisone injections. Long-term steroid use can worsen arthritis degeneration. The inflammation needs to be localized to the area of the injection. Insurance may not cover it until after other options are exhausted. You're limited to 3 a year. Price can be expensive. Should you take NSAIDs? NSAIDs, or non-steroidal anti-inflammatory drugs, include medications like Aleve, Advil, Motrin, and their generic forms, and aspirin. These are typically taken in pill form, though they could be creams, and are used to decrease inflammation. Many NSAIDs can be found over the counter and can help reduce pain and inflammation. They work by targeting the inflammatory mediators at the site of inflammation. This is different than Tylenol. Some considerations for NSAIDs are long-term NSAID use can cause GI and kidney problems. NSAIDs shouldn't be used in combination with medications that alter the blood, such as blood thinners, anticoagulants, and others. Anti-inflammatory benefits need a higher dosage than the pain-relieving dosage. Over time, your body adjusts to how much you're taking, and you may need more to have the desired effect. Should you take Tylenol? Tylenol, or acetaminophen, is a pain and fever-reducing medication. It's taken in pill form and can be found over the counter. Tylenol reduces pain, though it does not touch inflammation. So if inflammation is the cause of your pain, Tylenol will have little to no effect. Tylenol works by modulating or changing how your body perceives pain in the brain. Some considerations for Tylenol. Long-term Tylenol use can affect the liver. Tylenol is mostly broken down by the liver, so beware if you're using alcohol heavily while taking Tylenol. Over time, your body adjusts to how much you're taking and may need more to have the desired effect. It's a low-cost option. Should you ice? Ice in the form of ice cubes in a bag, cold gel packs, cryotherapy units, and others is common for pain and inflammation. Growing up, I would always hear, ice an injury, and my mom would put a bag of ice cubes on whatever I injured, which was a lot. I was an athlete. Ice is easy, it's affordable, and readily accessible for most people. It stops inflammation by cooling down the area so the blood vessels constrict to not allow more of the inflammatory response from your body, which involves bringing fluid to the area, which makes it swell. Ice also numbs the area, which stops pain. Some considerations for ice. Ice in the form of ice cubes in a bag and gel packs need to be used for 20 to 30 minutes to be effective. Ice needs to be used frequently in the first 1 to 2 weeks of starting to use it for it to be effective. This looks like 5 times a day for 14 days. Use a thin layer of cloth between a gel pack and your body. Ice cubes can go directly on your skin. Should you use heat? Heat in the form of a microwavable heating pad, electric heating pad, warm cloth, hot bath, and others is a common treatment for pain, inflammation, and tightness. Growing up, I always heard use ice, not heat, for pain, but more and more I'm finding that's not true. Some people respond better to ice and some people respond better to heat, so find which one works for you. Heat works by expanding the blood vessels to let blood flow to the area. This can help bring nutrients to the healing area and take away toxins to help the body heal. Some considerations for heat. Heat needs to be used for 20 to 30 minutes for it to be effective. Heat needs to be used frequently in the first 1 to 2 weeks of using it. This looks like a hot bath every night for 14 days or a moist heating pad 5 times a day for 14 days. Someone with impaired sensation and cannot tell the difference between temperatures should not use heat, as you could get burned without knowing it. Electric heating pads should not be left on while sleeping because of burn potential. Swelling should not get worse when using heat if it's used correctly. So if you're noticing swelling's worsening, stop the heat. Should you use a TENS unit or an E-stim unit? A TENS unit, transcutaneous electrical nerve stimulation, is a type of pain modulation. When used properly, this can modulate the way the brain perceives pain and can help localized swelling. This is typically seen in a physical therapy clinic when they hook you up to a small or medium-sized machine and put the 4 pads on your skin connected to the machine. You'll feel a buzzing or a tapping sensation. It's often used simultaneous with ice or heat. Some consideration for TENS units. It should not be used during activity. TENS should not be used in a way other than described in the instruction manual. TENS should not be used if someone doesn't have adequate sensation in that part of their body. A TENS unit usually modulates the pain while the machine is on and working, and for a very brief time afterwards, so 1 to 2 hours. Should you exercise? Exercise can include a wide array of activities. Exercise can help reduce soreness, tightness, and stiffness when done correctly. The thing with exercise is it's not good for getting rid of pain. It's good for getting rid of soreness pain, or tightness pain, or stiffness pain. If you have sharp-shooting, unrelenting type of pain, exercise isn't a great option. Gentle exercises get rid of soreness, tightness, and stiffness by moving and stretching muscles and joints to help stretch out a muscle or a joint, improve circulation, and decrease stagnation or lactic acid buildup. Some considerations for exercise. Exercise may worsen symptoms when done too aggressively, incorrectly, or too much. Exercise should always be tolerable. It's not a no pain, no gain. Exercises may need to be modified to be more tolerable. Exercises are readily available. You can find many options online or talk to a local physical therapist or personal trainer to find ones that work for you. Should you get a massage? Massage is a common treatment used for muscle soreness, tightness, and feelings of stiffness. Massage doesn't do a great job at relieving pain. It's good for getting rid of soreness pain, tightness pain, or stiffness pain. So if you have sharp-shooting, unrelenting type of pain, massage is not a good option for you. Massage helps get rid of soreness, tightness, and stiffness by improving circulation to improve blood flow and decrease lactic acid buildup. It also helps work out muscle knots that can be uncomfortable. Some considerations for massage. There are different types of massage. One may work better for you than another. Different massage therapists will have a different amount of pressure. One may work better for you than another. For someone with heart or kidney problems, get clearance from your physician before getting a massage. Massage typically needs to be done 60 to 90 minutes once a week for 1 month initially to be effective, and then a regular massage 1 to 2 times a month for maintenance. Should you do acupuncture? Acupuncture is a part of Chinese medicine and can help relieve pain. From my basic understanding of acupuncture, it works to modulate how your body perceives pain and may release endorphins. Some considerations for acupuncture. Not for someone with a significant needle phobia. May not be for someone with a bleeding disorder. May not be for someone with skin infections or disorders. Should you eat an anti-inflammatory diet? Anti-inflammatory diet is a general term used to describe following a plan that involves eating foods that have anti-inflammatory properties and/or avoiding foods and ingredients that increase inflammation. An anti-inflammatory diet isn't one particular diet. There are many of them. Whole30, Paleo, AIP, varying walls protocols are all considered anti-inflammatory. There are food groups or ingredients that many people believe increase inflammation for everyone. For example, gluten and dairy. However, this may or may not be true. Different foods and ingredients may affect different people differently. 2 types of foods or ingredients that seem to be very consistent across most or all groups talking about anti-inflammatory are limiting refined sugars and processed foods. Because of the way these types of foods break down in the body, it creates a reaction that increases inflammation. Some considerations for an anti-inflammatory diet. They're good at controlling inflammation. They do not cure disease, so someone on an anti-inflammatory diet may still need medical management throughout their life. It's a significant lifestyle change. It requires reading all food labels and asking questions when dining or ordering out. It's not just cutting out one or two different types of food, like candy and bread. There are many options to follow based on your specific likes and needs. Should you do gel injections? Gel injections are a type of shot to relieve pain and improve cushioning in your knee. These are typically used for someone after they have tried and failed other treatments like steroids, NSAIDs, creams, Tylenol, and others. These work by injecting a substance into your knee that's already naturally occurring to help lubricate your knee and act for shock absorption. Some considerations for gel injections. The inflammation needs to be localized to the area of injection. Insurance may not cover it until other options are exhausted. A limited number of injections per year are allowed, and the price can be expensive. They don't work immediately. It can take up to 2 weeks to work. Should you stretch? Stretching is something everyone should do as part of a balanced routine, but in terms of stretching for knee pain relief, it may or may not help. Stretching helps improve flexibility and decrease muscle tension. If your pain stems from tight muscles or being in the same position for too long, then stretching can help. But if you did something like twist your knee or injure it in another way, stretching will do very little to help you right now. Or if you try stretching the area that hurts and you don't feel the stretch or you don't feel it in the area that hurts, it's unlikely to help for this problem. Stretching works by elongating your muscles and pulling the muscle fibers from each end of where the muscle attaches. And over time, prolonged stretching changes the resting position of the muscle so it's longer at rest. Some considerations for stretching. It can take about 1 year of regular stretching to change resting length of muscles. You can see an immediate change in muscle length that lasts temporarily after you stretch. Stretching helps pain and soreness caused by muscle tightness. Forcing a stretch can create rebound tightness and soreness. Pain caused by another incident other than muscle tightness is unlikely to respond to stretching. Should you use creams? Creams are a low-cost solution to superficial pain. Creams can be medicated or not. Medicated creams are often NSAIDs and work by the medication being absorbed through the skin. Non-medicated creams may have essential oils or something else infused in them, like menthol, for a cooling effect. Medicated and non-medicated creams can work for pain that stems from a superficial source, so something close to the skin. If the pain stems from deeper than the skin or directly under the skin, creams are unlikely to help. Some considerations for creams. They go a little deeper than your skin. They're a low-cost option, medicated or non-medicated options. If a problem stems from deeper than just under the skin, creams can't reach it. Complete rest may be necessary temporarily after a broken bone, torn ligament, surgery, illness, or other things. Outside of those factors, complete rest for any length of time should be used sparingly. Complete rest rarely helps pain by itself. Complete rest may be necessary for the healing process, but it's usually not the part of the treatment plan that helps get rid of and keep pain away. Instead of complete rest, consider active rest. This is where you don't participate in the activities that worsen pain and you find alternatives in the meantime. Rest can help your body get the break it needs to help heal. If you break a bone, you feel pain from the inflammation and the break. Resting that area that's broken is needed to allow the bone to fuse together. But if you jump right back into your usual activities without doing other treatments, you're going to have pain in other ways even after the break heals. And if your knee hurts to walk or run and you lay on the couch for 2 weeks to let it heal and jump right back up into the walking or the running you were doing, your knee is likely to have that pain again when you walk or run. Considerations for rest. Complete rest alone is unlikely to heal pain from minor problems. Complete rest may be necessary temporarily for major illness or injury. Consider active rest instead of complete rest. Definitely work your way up to activities after a period of complete or active rest to prevent pain from coming back or popping up in other areas. Should you lose weight? Weight loss may help your pain. When it comes to knees, they feel 3 to 5 times your body weight when you walk and up to 10 times your body weight when you run. So losing some may help. Consider this. Skinny people also have knee pain. The weight may not be the whole problem causing the knee pain, because if there were no other factors to cause knee pain, it would likely be that skinny people wouldn't have it either. Instead, it could be the changes made during the weight loss journey, eating differently, exercising, stretching, focusing on the equipment you're using during this transformation, and other things, may be the things helping your pain in addition to, or more than, the weight loss. Some considerations for weight loss. Weight loss does take pressure off your knees when walking and running. Skinny people also have knee pain. Other changes you're making at the same time may play a big role in your pain management. Should you go to physical therapy? Physical therapy can help with pain relief from modalities they use for pain management and by modifying the way you move. You'll want to pay attention over the course of physical therapy to see if it's helping your pain. Physical therapy should include various treatments that make at least a slight difference within 2 weeks. For example, if all that's being done is strength exercises and stretches with no other treatments, I found that these treatments alone don't fix pain, but instead are better at preventing the pain from worsening or coming back. Modalities like ice, heat, TENS, and others can help with pain relief in the moment. So if the exercise or stretch is being used to keep the pain from worsening, then modalities can help by being used before or after to calm down or prevent pain from the exercise or stretch. When in doubt, ask your physical therapy what the goal of each tactic is and keep an eye on it for 2 weeks. Because if they say the tactic is for pain relief, it should be helping get rid of your pain. Some considerations for physical therapy. It must be completed with a physical therapist. If you Google physical therapy for knee pain and do some exercises and slap some ice on your knee, that's not physical therapy. That's exercise and ice. If you don't like your physical therapist or you aren't seeing the results you want, find a new physical therapist. Even if you're doing the same exercises at home and in the clinic, doesn't mean you can just quit PT. There is a method to the madness. Just because physical therapy didn't work before doesn't mean it won't work now. You may not have had the right physical therapist, the right programming, or have been following the directions correctly. Should you get a knee brace? Knee braces can give your knee some external support it's not getting elsewhere. Knee braces come in a variety of different materials, from rigid plastic to neoprene sleeves. The way they work depends on what they're made out of. So a hard, rigid brace blocks movement in certain directions to prevent the knee from overstretching that way. For example, a brace that's fitted after an ACL injury or reconstruction will limit forward movement on the shin bone because that's the direction the ACL gets torn from. It may also limit other directions. Some people with significant knee deformity wear offloader braces that are rigid, and they prevent the knee from moving in a direction that would collapse the knee joint, because when the knee joint collapses that way, it causes pain for those people. Other braces like neoprene sleeves may add compression to control swelling or add sensory input to make the knee more comfortable. Some braces are needed temporarily to decrease pain or prevent further injury, but many can be discontinued or avoided completely when proper strengthening is incorporated into your routine. As I said before, some knee braces are adding external support that your body needs because it isn't getting it somewhere else. That somewhere else could be in the form of internal support from your muscles. Some consideration for knee braces. Neoprene sleeves don't have external support like rigid braces, so they don't help control motion. Rigid braces alone don't add compression, so they don't help control swelling. Rigid braces may be necessary for someone who has a bony deformity or a previous ligament injury that strengthening won't fix or prevent the movement. If you can control the positioning of your knee with focused attention on maintaining that position, rigid knee braces may be helpful temporarily while you work on strengthening your muscles to be able to hold stability better. Knee braces should never be used alone, but always in conjunction with a balanced plan to address all aspects of stress on your knee. Should you take supplements? Supplements may or may not help pain. Dietary supplements are used in addition to something you're already doing. Supplements could be adding collagen powder or liquid, adding vitamins and minerals, or a more natural pain relief treatment. If you're adding collagen powder to your morning coffee or your morning smoothie, it won't take away your pain. Collagen supplements the collagen in your body. Collagen is found in muscles, tendons, ligaments, and cartilage. So there is potential for collagen to help support your arthritic joints. But if pain is caused by inflammation, then collagen doesn't help. Supplementing vitamins and minerals could improve your dietary health if you're low in them and cannot get them from your normal food sources. But if pain is from inflammation, then this won't help. Adding magnesium may help with muscle pain and soreness, though there are other ways of getting magnesium other than ingesting it, like taking an Epsom salt bath. Supplements for natural pain relief may or may not work. These types of supplements may or may not be approved by the FDA, and there may not be enough testing to show efficacy on pain relief. I have not seen results that adding a pain relief supplement alone was the thing to take away pain. And it's in the name itself, supplement. It should be supplementing other techniques you're doing. Some considerations for supplements. Natural pain relief supplements may or may not help. They may or may not be approved by the FDA, and there may or may not be enough testing to show significant efficacy. Supplements like collagen support muscles, tendons, ligaments, and joints, but don't give short-term pain relief. Supplements like vitamins and minerals typically don't give short-term pain relief. You may be able to find other ways to use minerals like magnesium in other ways like Epsom salt baths. Supplements help when you aren't getting enough of that ingredient in your normal diet. Supplements are just that, supplements, and should be used to supplement where you aren't getting enough. Considerations for any treatment you use for pain relief. Very few treatments work alone. They are often used in conjunction with other things you're doing. When we talk about knee pain, the pain has come on because of some kind of stress to the knee, whether that be from an injury, you fell down while running and getting banged up from the fall definitely adds stress, or from the repetitive nature of overtraining, over or under strengthening, under stretching, wearing the wrong shoes, and it's all added stress to your knee. To manage the pain is to handle the amount of stress put on your knee by balancing out the stress with relief things in the form of ice, heat, hot Epsom salt baths, massage, foam rolling, eating to fuel and support your body, and other things. To get rid of pain, decrease exposure to what is causing the pain. If the pain is caused by inflammation, instead of trying to get rid of the pain, why not get rid of the inflammation and prevent it from coming back? It's like if you hit your head on something every day and you take an Advil. Will the Advil get rid of the pain and inflammation? Yes, it will. But wouldn't it be better to avoid hitting your head every day so you don't even have the pain and inflammation? Yes, I think it would. Be sure to like, comment, and subscribe. Hit that bell so you're notified every time a new video comes up so that you can run without knee pain.